This PetX Talk is brought to you by Pet World Media Group, your partner in all things pet media. Additional funding and considerations provided by Natura Pets, Found Animals, and Dogwise Publishing. Are you ready to be empowered? Then join us for this PetX Talk.
Hi, my name is Dr. Karen Becker. I am a proactive, integrative wellness veterinarian. Proactive vets really strive to identify lifestyle obstacles before disease occurs, which is actually opposite of most reactive veterinarians. Wellness veterinarians try to identify lifestyle obstacles and remove them before problems happen. And integrative veterinarians start with the least toxic options first. So at my practice, I do acupuncture, homeopathy, we have nutraceuticals, Western herbs, Eastern herbs, and if that doesn't work, sometimes you have to break out drugs and work up the spectrum, but we always try and start with the least toxic options first. So I'm a small animal practitioner in the Chicago area, and I also host a large online animal wellness website, mercolahealthypets.com. So today what I'm going to talk about are the 3 pillars of health, specifically the immune system. So at my practice, I have hour-long appointments, and most of the time when clients come to see me, they're bringing pets that are really sick. So most people don't consider integrative medicine, to be honest, until they're desperate, or maybe traditional medicine hasn't worked for their pet, so they're thinking about trying a holistic option. When clients come to see me, they usually have been to 3 to 4 different veterinarians, and they're stressed, they're overwhelmed, their pets are obviously sick. So I primarily see cancer, pets with uncurable or raging allergies, pets that have musculoskeletal issues like arthritis or obesity, diabetes as well, and other metabolic issues that are causing pets to be unwell, as well as organ failure. So I see a lot of bottom of the barrel cases, and these people are coming to me usually because they're desperate. Obviously, they would do anything to help their pet survive. And even though, let's say they want to come and talk to me about cancer or a specific issue, like my dog has recurrent ear infections that I can't clear up, I always cover the 3 pillars of health at every exam, because there's actually no one pillar more important than the other, and it's how I've been able to help people get this holistic approach in their brains to be able to recognize that all aspects of wellness have to come together for a body to thrive and be vibrant. So the 3 pillars of health are: number 1, species appropriate nutrition; number 2, a balanced, resilient immune system, which is what I'm going to be talking about today; and number 3, a strong, resilient frame and organ systems. So keep in mind, if the nutrition's off, nutrition is the foundation of health and wellness, of course. So if you have a thriving body, but you're not nourishing the body well, the body will break at some point. If you are doing a great job with nutrition, but maybe you're over-vaccinating, you're not recognizing that your dog or cat has an immune system issue, you're really no further ahead. Likewise, if you're focused on a beautiful diet, but your pet blows an ACL, or your pet has an obesity issue, you end up recognizing that, or your pet, God forbid, goes into liver failure or heart failure. At that point, that last pillar of health is most critical, but really they all come together because you can't decipher them, and they're all really important to address. So if I do see a client that brings me a kitty and kidney failure, we will always, and so they say, listen, I'm here just to talk about the kidneys. And I said, right, but the kidneys are attached to an immune system, which is attached to a body that has to be nourished appropriately. So I've been able to, in my practice, address all 3 pillars at every exam, and that's how I am able to encompass really, truly holistic an outlook on animals by addressing all 3 pillars. So today we're going to talk a little bit about the immune system. So the goal of a healthy pet's immune system is to be balanced. So on the immune spectrum, you have balances in the middle. That's what we're all striving for. It's where we want our pets to be, right in the middle. You have an underactive immune system on one side and an overactive immune system on the other side. And both of those spectrums are quite unhealthy. So for a balanced immune system, what we know about immunologic health in general is that the immune system is really based on 2 factors: genetics and the environment. And so we have to address both of those. Now, if you have rescued a dog or cat, and maybe mom and dad were brother and sister, maybe it was an accidental breeding of father-daughter, genetics may be not a key strength. Even if you're shelling out good money for a well-bred dog, we actually see significantly more health issues across the board in veterinary medicine with animals that maybe have amazing pedigrees. Unfortunately, the AKC does allow line breeding, which means you can breed close relatives together, and the AKC will paper those dogs. It's offensive to me, ethically, morally incorrect, but it's still a practice that occurs in the United States. So you can shell out $5,000 or $6,000 for a well-bred dog and end up with an incredibly thick medical file at the end of that patient's life because the animal looks beautiful, but wasn't bred for really good, resilient immunologic health. It was bred for beauty. So beauty pageants don't win in veterinary medicine. We're going after strong, diversified gene pools. So this is what I tell all of my clients. If you're going to shell out cash for an animal, if you're going to spend tall money for a dog or cat, you better darn well do your research, which means you've investigated the cause of why grandma died, you've investigated what the animals are being fed, you've investigated their vaccine status. You have to know in your hearts of hearts that the DNA testing has been done, that everything has been done to the best of your ability, reduce the likelihood of having a genetic flaw pop up. Now, everyone knows that all breeds have genetic weaknesses or flaws. Needless to say, if you're going to get a golden retriever, leading cause of death of golden retrievers is lymphoma, a type of cancer. If you're going to shell out money for a golden, you would absolutely really interview your breeder very, very well about, is there lymphoma in the line? When we trace it back, has there been any implication of immunologic disruption whatsoever? You can ask some really good questions. Now, if you're rescuing, which I hope you do, I hope everyone out there is going to the Humane Society or shelter or doing what they can to reduce the breeding issue, the overpopulation issue in this country. We don't have control over genetics. And in those situations, it is what it is. Now, here's what's cool. You rescued a dog and maybe you can tell that maybe that dog has some Cavalier King Charles Spaniel in there. And we know that Cavaliers oftentimes have heart-related issues, so they're very prone to a heart condition called mitral valve prolapse. So you think you have a calf, you can do some really cool DNA testing to find out what your dog mutt is, so you can identify where there could be some genetic predispositions. Now here's what's cool. Dr. Jean Dodds really has pioneered the field of veterinary nutrigenomics, and we love her for that. And really what we know in human medicine, we also know it's true in our dog and cat populations, but there's an emerging field of science called nutrigenomics, which is really the up or down regulation of the body's DNA potential by how you nourish it. And really, that's pretty cool. When I went to vet school 20 years ago, I was basically taught that genes are genes and DNA is DNA, and if you got the DNA in the dog for having a problem, it's going to come out and there's nothing you can do. And we actually know now that that's not true. And how cool, even in our own bodies, we have a DNA that can remain dormant or could be expressed depending on how we live our lives. And the same is true for our pets. So let's just say, even though you may have a dog that is a golden retriever, and you do find out that mom and dad were brother and sister, and you do find out that there's lots of lymphoma in the dam in sire's background, you don't need to panic. You do need to be proactive in recognizing that there are things you can do environmentally to actually up or down regulate that DNA from being expressed, which should be totally empowering to you as a pet parent. We are not victims of our DNA. We all have DNA that is less desirable, and we have DNA that is amazing. And what we want to do is down-regulate the less desirable options and up-regulate the body's ability to be resilient and strong. And that's done through environmental choices. So yep, I just said the immune system is based on two things, environment and DNA, but it's important to recognize that we have full control over our pet's environment. So what can we do to help keep the immune system balanced? Well, keep in mind an underactive immune system. Yes, pets can be born with a dysfunctional, depressed immune system. That is rare. So could your pet be born with IgG, IgM, and IgA deficiency? Yes, it can occur. But most of the time, pets are born with a balanced immune system, and then through environmental choices, maybe we over-vaccinated, maybe we fed foods that contain known carcinogens. So if you're feeding dry food that has been extruded, dry food, unfortunately, in every bite of extruded food, there is a byproduct of the production that produces cancerous byproducts called acrylamides and heterocyclic amines, which is what happens when you heat food at very high temperatures, which is how all dog and cat dry food is produced. If you're feeding your dog a small amount of carcinogens every day, could that allow for abnormal cell growth, which is the fancy word for cancer, to occur? It can. So on the far end of immune failure, you have abnormal cellular replication, which is the fancy word for cancer. That's total immune failure. So the body, our pets' bodies are amazingly equipped with resilient, great scavenging systems to be able to recognize 2 cells become 4, and 4 cells become 8, and this cellular replication is happening all the time in our pets' bodies, actually happening in our bodies too. But here's what's awesome: if we have a really resilient, strong immune system, the body's capable of recognizing abnormal cell growth, and we just obliterate those abnormal cells. It's a beautiful system, as long as the system works. If your pet has developed cancer, his or her scavenging surveillance system has failed them. And the question is, why? Could they have been born with a faulty immune system? Yep, but rare. Probably something in your pet's environment that caused immunologic failure. And this is when we evaluate things in the environment. Are we putting flea and tick medications on an indoor house cat that never goes outside? That's absurd. These are known pesticides, herbicides. Are we having Chemlon spray our beautiful dandelion-free front yard that our naked fuzzy dogs are walking through and then licking their paws? Those little flags that say don't walk on the grass, pets can't read, and they're naked, and they don't wear shoes and socks, and they don't shower every day. These are known carcinogens or cancer-causing substances that our pets are exposed to at a tremendously high level because they have a different lifestyle than you and I do. So when we start thinking about environmental chemical load, chemicals, toxins, preservatives, unnecessary ingredients in the food, how the food's manufactured, the freshness of the food, the biologically appropriateness, or how healthful the nutrition is, we know that dogs and cats don't have a carbohydrate requirement. And if we carb load carnivores, we know that a pro-inflammatory grain-based diet creates inflammation. And we know inflammation causes a lot of the itises within the dog and cat population. So long-term uncontrolled inflammation coupled with a lot of toxicities in the environment, coupled with maybe not the best DNA, could your pet end up with immune failure, or at a minimum recurrent chronic infections? Yes. Balance is where we want. On this side of the immune spectrum, this is an underactive immune system, balance. Overactive immune system. Right about here we have allergies, which are an immune system overreaction to things like ragweeds, grasses, pollens, molds. There are a lot worse things than allergies in a patient's life, but the question should be, why does my pet have allergies? If your pet should be able to breathe in ragweeds and say, the immune system should say, oh, that's ragweed, nothing to worry about. If your pet has an allergy going on, your pet's immune system's overreacting. One step beyond an overactive allergic response is a condition called autoimmune disease or immune-mediated disease. And that's where your pet's immune system is so amped up and so confused that it actually attacks itself. That's total immune confusion. So the goal that proactive veterinarians have, like myself, is to help educate pet parents to recognize we don't want an underactive immune system and we don't want an overactive immune system. We want to make wise lifestyle choices so that your pet's immune system can remain balanced and healthful for the life of your pet. So it's important that we focus on species-appropriate nutrition for our pets. We focus on a resilient, balanced immune system, and we focus on creating a thriving, healthful body and organ systems. Regardless of what's happening in your pet's wellness or illness history, it is our role as their guardians to take on the very best approach that we possibly can, feed them the very best food we can afford to feed, and have enough knowledge to be able to address issues as they come up in our pets' lives so that we're able to make the best decisions for their overall care and well-being. This is Dr. Karen Becker.
We're here with Dr. Karen Becker, who just did a wonderful PetX talk, so insightful. There are a few questions I want to follow up with, including proactive versus reactive. It's so important for us pet parents, but where do we start so that we can become more proactive instead of reactive?
It's a great question. You have to start with a shift in how you view wellness. So if right now, most people, if I were to say to you, when do you bring your dog or cat to the vet? The answer for most people would be when they're sick, right? So the first mind shift has to come in if I can intentionally partner with a proactive veterinarian who's going to identify, you know what, my dog is bearing, she just measured quad bundles on the twice a year, every 6 month wellness visit. The goal is to prevent disease in the next 6 months. So let's say that I measure quad bundles and I find that the dog's offloading to the right. There could be, let's say, a minor ACL strain that we didn't even identify, that we're able to say, okay, look, your dog actually has a 0.5 centimeter difference in muscle mass. Your dog is reactive at the TL junction. I'm noticing your dog's has some plaque and tartar on the back teeth. I can create a 6 month plan for the next 6 months to remove the plaque and tartar. The dog maybe is 8 years of age, starting to have some minor age-related eye changes. We can put that dog on high antioxidant loads for specifically addressing age-related changes in the eyes. We're going to do some things to help retrain maybe muscle balance or some specific therapeutic exercises for that left leg that's slightly smaller, maybe chiropractic adjustment, send you off for 6 months with a list of what you need to do to prevent illness from happening versus dang, the ACL ruptured. Now we're looking at surgery. We're looking at rehab. You know what? We're looking at plaque and tartar that's thick enough because we didn't address it 6 months ago that now we have to do a dentistry, which is anesthesia and $500 and scary. So there are things we can do as the aging is a dynamic process. So as the body's going through a life aging process, if we are specifically fine-tuning a protocol to meet that animal's needs at that point, degeneration oftentimes doesn't occur. Animals can go through their whole lives never needing dentistry because we addressed the plaque and tartar as it was happening. That is a 180-degree different approach from 95% of veterinarians in this country.
Another great topic that you touched on in your talk was genetic issues. But what I really want to ask you is, we now have better research, we have better tools available to identify potential genetic issues.
We do, thankfully.
How do pet parents get more proactive on that side of things?
Great question. So there are some neat new DNA tests that are available. So the Orthopedic Foundation, OFA, Orthopedic Foundation of America has some of these DNA tested kits available on their website. And your veterinarian can run them. You can go to state teaching hospitals to run them. But what's neat is if you determine that you have a high-risk breed for certain types of genetically predisposed diseases, you would be able to test your pet. And if your pet has that DNA, you're able to change the diet, modify the vaccine protocol, reduce environmental chemical load. You're able to do things to actually offset the likelihood. If your dog is asymptomatic right now, which means your pet's carrying the DNA for disaster to strike in 2 years or 4 years, why would we ever wait until they got sick to fix them? We can identify that they're carriers of this DNA. It's in their body. What can we do to have that pet never become ill, even though the DNA is there? And that my goal in life is when I have animals that have a genetic predisposition, it's to get them to the end of their lifespan never having that DNA expressed. And it's possible through wise lifestyle management.
Wise is the key word here. My goodness, thank you so much for all the wonderful wisdom, the insights you're giving us. Thank you for everything you're doing in the pet world.
My pleasure. Thank you for having me.
Thank you for joining us for this PetX Talk. To learn more information about Dr. Karen Becker, visit drkarenbecker.com. Funding for PetX Talks is provided by Pet World Media Group, your partner in all things pet media. Additional funding and considerations for PetX Talks is provided by Natura Pets. Natura Pets can help you optimize your pet's health with premium organic supplements from the Amazon and Andes Mountains. Visit naturapets.com. Dogwise Publishing, all things dog. For all of your expert dog book needs, visit dogwise.com. Found Animals, working towards big ideas that advance the safety and happiness of animals in our homes, our shelters, and everywhere in between. Visit foundanimals.org. Special thanks to Pet World Insider, taking you inside the world of pets. Visit petworldinsider.com for more expert radio interviews, articles, and videos. This has been a Pet World Media Group production.